Hi, everyone. Thank you so much for joining the League of Women Voters Northern Lower Michigan Public Forum this evening. I am Lisa Blanchard. I'm the Vice President of the League of Northern Michigan, of Women Voters of Northern Lower Michigan. And I would like to offer a few reminders as we start. First, please be sure to remain on mute during the presentation. It's best to click on speaker view instead of gallery view so that the focus is on each panelist as they present on our topic. As usual, this presentation is being recorded and it will be made available on our YouTube channel. We've already had people contact us about watching that YouTube. Part of tonight's presentation will include a Q&A, so please use the chat function to ask your questions, and a moderator will be checking those. You can write your question at any time, and they'll be read after the panelists have finished their segments. So for those of you unfamiliar with the League of Women Voters, we are a nonpartisan political organization that encourages informed participation in government. We work to increase understanding of major public policy issues and influence public policy through education and advocacy. We do not support any political candidate or any political party. We do have positions on public policy, however, and these inform our advocacy work. And the League of Women Voters has a detailed policy on preventing and reducing poverty and ensuring that basic human needs are met. So our Equal Rights Advocacy Committee has organized this forum to help educate us on the challenging economic and life situations of some of our neighbors who are one paycheck or one event away from poverty. And since March is Women's History Month, we use this month to highlight equity topics related to women. And this presentation will have an emphasis on women and families. We are so fortunate to have local experts on this topic and friends of our organization as our panelists tonight. Let me first introduce Rebeca Otto, who wrote a brief bio for me. After moving as a young child to Northern Michigan from her home country of Mexico, belonging and inclusion became lifelong focuses for Rebeca Otto. In the present moment, that passion overlaps with her professional role as the Director of Community Impact for the CharEm Region for United Way of Northwest Michigan. Already living the organization's mission of connecting and mobilizing the caring power of our local community to advance the common good, Rebeca delights in community building and fiercely advocates for marginalized communities in spaces where their voices aren't represented. And Gail Kloss started at the Women's Resource Center of Northern Michigan in February of 2010 as the finance director. And on June 1st of 2015, Gail became the executive director. Gail has lived and worked in the Petoskey community since 1985. She volunteered as a Girl Scout leader, assisted with Boy Scouts, and volunteered as her church financial secretary for 11 years. It is our pleasure to have you speaking with us tonight. Thank you so much. We appreciate you sharing your expertise, and I will turn it over to Rebeca.
Thank you so much for having us here tonight. If anyone knows me, they know that I can talk about this next topic for quite an extensive amount of time at the drop of a hat. I love giving context to what's going on in our community, and so this is the latest dive into what is called the ALICE report, which I'll explain in a little bit. So ALICE stands for Asset Limited Income Constrained Employed. It is something that started out of a United Way in northern New Jersey. They were trying to find a way of really telling the story of those who were below the federal poverty line, or above the federal poverty line, but below a household survival budget. So that's one thing that I want to bring to light right at the beginning. Since we have poverty in the title of what it is that we're talking about, it's somewhat misleading in that poverty has federal definitions, which are required for a lot of the social programs that we have in our community. And that hasn't been addressed again since the 1960s when it was created. It's also something that is across the board in all of the 50 states. And so it's a bit harder to understand the true struggle of each community if we're looking at it from this blanket standpoint. So the United for Alice team tried to think of a different way of looking at numbers that were already available and really getting a better picture of the struggle of each community. So they came up with this ALICE framework, and ALICE stands for Asset Limited, Income Constrained, Employed. And so what they were looking at is people who are limited in their assets. They don't have an extra car or a boat or a home that they can sell. So they're really don't have anything that they can then liquidate and deal with a financial hardship. They're income constrained in that their education or their current job doesn't allow for a lot of upward mobility, but they are employed and often working multiple jobs trying to make ends meet. And so this ALICE framework was developed looking at US Census information and American Community Survey information to look at each community. And so they were able to look at each county and figure out what is the household survival budget for each county in each state that participated. Michigan chose to start participating in 2014 and has been a member state since then. There's a report that comes out about every 2 years that gives us the newest metrics. And so one of the things with this latest report that came out is that it came out post the start of the pandemic. And also post the latest US Census. And so we anticipated, because of the start of the pandemic, that we were going to see really drastic detrimental changes to our numbers. And what we found overwhelmingly was that all of these different things that were happening at once, where people were moving jobs and they were losing jobs, but they were also getting these pandemic assistance, or there was eviction moratoriums going on, that because of all these competing forces, they were actually faring a little better than they normally do, because there was a lot more assistance coming out to everyone all at once. And so the numbers that we thought were going to be really detrimental actually proved to be an improvement in a lot of places, unexpectedly. This next report that will come out, I think, will be a truer picture of where we are, because it will be after a lot of the expiration of pandemic supports that have been put into place. So for the state of Michigan, the 20 most common jobs, 70% of those jobs still pay less than $20 an hour. And when you're looking at our particular sector, our highest number of jobs is in retail sales and fast food service workers. And so they aren't making enough in those jobs to be able to support a household budget. What I'm going to show you next is a graph that gives you the information on the left-hand side. What's in blue are shades of what has been determined to be the household survival budget for the communities in Michigan. This is all 83 counties. And as you can see in there, we've got housing, childcare is a pretty big chunk. This is looking at a family of 4, so 2 adults in the home and 2 children. There's also food in there, healthcare, transportation. Last report was the first time that they put technology into it, because they really identified that as an area that was essential to a household budget to really track. Technology is essential in terms of applying for jobs, working remotely, having kids in school that are doing online learning. And so they broke that out into its own category. And then this time around, this latest report, they broke out the taxes portion of it, because they wanted to compare that against the supports that people are getting to be able to make ends meet. So if you look at that next column, you'll see that a 2 full-time worker household, because of the additional supports that are in green, which were happening because of the pandemic, they actually finally had enough to make ends meet. So again, these are people that are well above what is considered the poverty line, but certainly less than what they can survive on. And then if you look at the next column over, you're looking at 2 part-time workers who are going to get additional supports because of that part-time employment, but still not making enough to survive. And that last column in the gray, that's where the federal poverty line stands right now. So you can see in stark contrast that poverty is much, much lower than the actual household survival budget. So I know that the League of Women Voters, this particular chapter of it covers Charlevoix, Sheboygan, and Emmett County. So I thought I would give you what those numbers are in what we call below ALICE threshold. So this is a combination of those that are under that federal poverty line, as well as those households that are below that household survival budget. So the latest numbers give us Charlevoix County at 36% of households below ALICE threshold, and Sheboygan County 43%, and Emmett County 33%. And I thought I would also give you a chance to see over the 5 reports that Michigan has had the trajectory of each one of those counties. So as you can see, Sheboygan has had a jump in their ALICE numbers, whereas Charlevoix and Emmett County experienced the drop mostly because of those pandemic supports going into place. ALICE households moved out of that ALICE range. Those that were in federal poverty level moved up into that ALICE range. So this is something that Gail and I share very passionately about, words being very important and the way that we phrase things being something that we really need to watch. And so another thing that's come out of this ALICE report is making sure that we have phrases that we should try to avoid, including working poor, because again, that's relating it to the poverty line, which as we see is not a valid measure of where things are. Calling folks needy, saying that they're living hand to mouth, assuming that they are uneducated, which is not entirely true. And also, again, people on welfare, which equates it to that federal poverty line that is not true of a lot of the households that are in our community. So instead, we like to say that these are other phrases that you can use to describe ALICE. So they are living paycheck to paycheck, just surviving but not financially stable, struggling to make ends meet. As Lisa said earlier, one emergency away from a financial crisis. And in a lot of the programs that we see in human services, you'll see these phrases, the 200% of poverty or 300% of poverty, as metrics for what is allowed for a certain program. Again, relating it to that poverty line. But again, as you can see by the percentages, not a real reflection of where we are. So what we do at United Way to try to address this, we have 3 pillars that we focus on, which are health, education, and financial stability. It's one of the reasons when the health department was facing leadership challenges in trying to pass some of the grants that they were going after, we stepped in to apply for one of those grants, which was trying to get healthy foods and healthy food education and curriculum into the local schools. It fell under that health piece of it. It fell under the education piece of it, and certainly under the financial stability of both the farmers that we are helping to support and then the kids that are benefiting from the food that's being brought in. So as Lisa stated in my bio, the focus of United Way is connecting and mobilizing the caring power of our local communities to advance the common good. The way that I've described what I do in my role is to pull up a chair at tables I wasn't invited to make sure that the other voices that should be there are being heard, because we can do better in these places where decisions are being made. So we like to remind people these are going to be common in any organization that is doing any type of fundraising. The advocating piece and the volunteering piece are very easy for us to remember. Obviously, every agency is looking for donations, and a lot of agencies have volunteer positions for people. But the one that I really like to remind people is that middle piece of advocating. Every one of you has, even just within your own social circle, people that look to you and value what it is that you say and how you live. And so being able to use this framework of Alice and those terms that are more dignified towards people who are struggling in our community is just one small way that you can advocate. Also showing up at those meetings as the Observer Corps does and making sure that those things are noted in a place where people can access that information is another powerful piece of advocacy. I know that you're not supporting any one candidate, but you are providing information to people who don't have access to those meetings because they're trying to make ends meet, so they can't be there. So don't forget the power of your own voice, even in small ways, to be able to get out the message to help other people out. During this pandemic, I like to remind people we were all in the same storm, but we were not in the same boats. Some of us had access to resources that allowed us to weather the storm a whole lot better than some other people. And we have to address each one of those situations in a way that really helps that particular family out. This quote by Terry Eagleton of genuine equality means not treating everyone the same, but attending equally to everyone's different needs. If the solution to everyone being on the water in precarious situations had been to hand everybody a paddle, it would have been dismissive of people who don't even have a boat to be sitting on. And it certainly would have been of no use to people who had multiple motors. And so when we're looking at how we can help in our community, really looking at how to individualize that approach to each person's situation and really seeing that individuality of that situation and being able to help them specifically. So one of the things that we have across the board, which is available all around the United States, it has a designation like 911. Whereas you would call 911 for an emergency, we have 211 for our needs. So 211 aggregates all of the human services help that is in our community and allows people to call that free 24/7 and get a list of potential resources in their community that they can access. And with that look at the broader picture of the need in our community, I'm going to turn it over to Gail to look specifically at the needs of women and children in our community.
Thank you very much, Rebecca. All right, and we'll have a little technical here. Make sure I share my correct screen. And put my screen up that I need to look at. Does everybody see the status of women as one large screen? Okay, fantastic. That worked well. So thank you so much for having me here today. I'm going to talk a little bit about Women's Resource Center of Northern Michigan. I'm sure many of you on this panel know about the Women's Resource Center. It started in 1977 when a group of women just really decided that there should be services for people in our area. They saw a gap and they tried to figure out a way to fill that gap. So they started the Women's Resource Center. So the mission of the Women's Resource Center is committed to equality, justice, and the well-being of women. To that end, we will engage and encourage our community to work with us towards those goals. We have a vision, and I'll just read some of the highlighted parts. Recognized as leaders for social change, an inclusive organization. We operate a fiscally sound organization, and we want to be known as a worthy investment and valuable community asset. We have values: eliminating the culture of violence, quality programs, understanding and respecting diversity, advocacy, leadership, integrity, taking action, and yielding positive results. In 1978, Michigan became the third state to pass legislation making domestic violence a crime. And there were even still some loopholes in that law that continue to get settled and flushed out. So in Northern Michigan, change started here. So in 1979, Women's Resource Center received its first grant from the Domestic Violence Prevention and Treatment Board. So at the state level, the state decided that every county in Michigan should have services for survivors of domestic violence, also called intimate partner violence. And so each county was set up with an organization, or an organization took on certain counties. So the Women's Resource Center of Northern Michigan serves 5 counties. We serve Sheboygan, Emmett, Charlevoix, Antrim, and Otsego counties. There are maybe 2 other agencies that have that many counties. There are some counties in Michigan where they might have 2 agencies that are serving domestic violence survivors. But every county in the state of Michigan has a resource for domestic violence. In 1980, the shelter opened in a rented facility. Prior to the rented facility, volunteers were housing women and children that needed a safe place to stay. In 1982, our current safe home was purchased. And it was purchased with some donations. It was purchased using gold mine resources, gold mine sales, and it was purchased with no mortgage. So it did not have a mortgage when it was purchased. Pretty amazing. The best way to reach the Women's Resource Center is our help and information line. We have 2 lines. We have a local line 231-347-0082, and we have an 800 number, which is 800-275-1995. So this is our help and information line from 2000. So our fiscal year is October through September. So 2009, 2010 would have started in October 1st, 2009. And as you can see, that number of calls has gone up and it's gone down. If you look, and I'm not sure if you can see my mouse, but this 18, 19, well, this 19, 20, 20, 21, 21, 22, really that pandemic time, it was a weird time. People were just hesitant to leave a situation that they were in. So some of our calls were down. I think people were kind of like, they don't know what COVID is going to bring. And so the known was better than the unknown. So we talked about intimate partner violence, also called domestic violence. If you were to talk to a law enforcement officer, they would talk about domestic violence also. Domestic violence under the law covers many different types of domestic violence. So it can be brothers, sisters, a mom and a son, you know, different types of relationships. The relationships that we're talking about is intimate partner. So that might be a current spouse, a former spouse, current or former relationship. Maybe you have a child together. So there's some type of relationship for our intimate partner violence, the folks that we serve. So 1 in 4 women and 1 in 10 men have experienced some type of intimate partner violence. Could be sexual violence, physical violence, stalking. It could be financial. There's a lot of different types. 26% of women and 15% of men have experienced intimate partner violence before they turn age 18. And then to connect it, even a little bit more. So the cost of intimate partner violence over a victim's lifetime was $103,000 for women and $23,000 for men. So there's definitely an imbalance on how financially it affects women than it impacts men. So these are numbers for domestic abuse survivors over the last, the 22-23 fiscal year. So our helpline took 1,016 calls. Our safe home housed 2,418 nights of lodging, and 1,121 of those were Emmett and Charlevoix County. There were 25 children from Charlevoix and Emmett County that stayed at the safe home, and we had 53 children total. 163 survivors of intimate partner violence from Charlevoix and Emmett County, and 409 regionally. So 409 includes all 5 counties. So here's the trend for our safe home nights of lodging. So you can see it goes from like 3,000 to like 2,479, I think is where it landed on at the end of the fiscal year. And again, recognizing that those years during the pandemic, we definitely had a reduced capacity. One was for safety, so we were putting things in place to help protect all of our residents. And then also again, that like because of the pandemic, because of COVID, that unknown, people were staying put and realizing that even though they're in a unsafe situation, it's the unsafe situation that they know. They didn't know what the pandemic, what COVID was going to bring. So this is our survivors at the shelter for adults in purple, and then in green, the children. And I say at shelter, but that also includes any housing or any individuals that we helped that we would have housed in a hotel. So if we have, our shelter is communal living. So at our shelter, we really house women and their family members. We do support male survivors. And what we do with male survivors is we house them at a hotel location, so they're in a safe place. And then all of the resources, all of the supports are still available to those folks that are staying in a hotel. Oops, my clicker didn't click for me. So we have folks that stay in the shelter, but we also have quite a few who have a safe place to live, but they still need some supports. Maybe they're working with an advocate, they're going through a court process. So these are individuals served that are not residential. They are in the community being supported with advocacy and other supports. So intimate partner violence, when we are working with a family, we are really talking about the safety of that family. As soon as a person decides to leave a violent relationship, that is when their lethality is at the highest. That's when they're most unsafe. So we are talking about safety plans. We're talking about what you need to bring when you're leaving. and that's just how we assist folks. So nationally, every day, 3 women are killed by a current or former partner. And if you look at all female homicide victims, 55% are killed by an intimate partner. And a lot of times, even mass shootings have some kind of connection to intimate partner violence. So sexual assault, students, college students, 1 in 4 women will experience rape or attempted rape during their college career. 84% know their attacker, 5% report to the police, and 42% tell no one. And more than 50% of campus sexual assaults happen during those first 4 months of college. So if you think about all of the different people coming together on campus, that first 4 months is really a high risk area for students. So then these are some of our local numbers for sexual assault. So we had 122 sexual assault cases this last fiscal year. 110 of those were female, 10 were male, and 2 did not disclose. 50 of those sexual assault victims were from Emmett County, and 28 or 23% of the sexual assault survivors were children. So we talked a little bit about that imbalance of intimate partner violence, women compared to men. So this is really a grid of earnings comparing women to men. So even the largest one, so that one is finance and insurance. So women are making about 42,000, and men are more like 100,000. And this is Emmett County statistics. So yesterday was March 12th, and March 12th is Equal Pay Day. So it is the day that the gender pay gap and pay equity gets caught up. So basically, for the amount that men have made from January to December of 2023, women have to continue to count their earnings until March 12th, 2024 to have that equal pay that men have. On average, women working full-time are paid just 84 cents for every dollar paid to their white men counterparts. Women of color, we know, are further impacted by that. The median earning for women in Emmett County is $30,110. And for men, it is $41,892. And so we really want to talk about how we as a community can help lift up those folks that are most vulnerable, like living right at that ALICE threshold. And so research has shown that connected communities play a crucial role in lowering the risk of sexual and domestic violence. Together, we can help end it by creating strong community connections and establishing a network of support, empathy, and understanding. So here are some actionable steps to help cultivate connected communities and to contribute to violence prevention, like increasing awareness, starting conversations about the prevalence of sexual assault and domestic violence. By attending here today, I would say that you are part of that. Support local resources, engage with organizations providing support services to survivors of sexual assault, ensuring accessible help for all of those in need. Community events, which is where we're at again today. Participate in the inclusive events that bring community members together, fostering a sense of value and connection for everyone. And safe spaces, encourage businesses, healthcare, law enforcement, and organizations to prioritize creating safe spaces, recognizing signs of abuse and responding effectively. And then reporting mechanisms. So advocate in your space, your workspace, your friend space for clear reporting mechanisms. Fostering a culture that supports survivors and ensures they can report confidentially. And then policy, like advocate for policies and initiatives that support survivors and address domestic and sexual assault prevention. Together, we can make meaningful impact and create a safer, more connected community for everyone. And then I just wanted to end by showing you how to reach out to the Women's Resource Center. Our 24 help and information line is really the way, probably the best way to access services. You can talk to somebody there. You don't have to say who you are. You can just reach out and talk to an advocate, maybe talk to that advocate about what's going on. They can help you determine if maybe you are in a situation where there's an imbalance of power and control. And you can at any time, day or night, talk to that person. You can call multiple times. Maybe you're not ready to give your name. Maybe you're not ready to make a move, but you can call and talk to an advocate multiple times, and just connect with them and talk to them about the situation you're in. If you are ready to leave, they can help you make that safe exit strategy and enter into safe home. Maybe you have a safe place to stay, so maybe it's not safe home you're going to. Maybe you're going to, mom's or grandma's or dad's or your best friend. You can still connect with an advocate, and that advocate can help you go through everything that you're going to go through and help you to let you know what to expect as you are traveling all of these systems that you've never traveled before. So I am going to stop sharing, maybe, if I get to the right screen. And I am not at the right screen. Okay, did that stop sharing?
And we do have some questions for you. Let's see, we have.
The first one is clearly for me.
Okay,
So
you want to take that one?
Yeah, does an actual person answer a 211 call? Yes, an actual human does. There's also the option to text 211 or search online on my211.org for resources. 211 centers are also connected. So if a community is going through a particular challenge, other centers can pick up more calls. A perfect example would be like wildfires out west when they were getting inundated with calls for resources. Other call centers across the entire United States could pick up the slack on those. Obviously, they're not going to be as well versed with resources, but they're still going to be able to search for what's in the system. Another purpose for using 211 would be some kind of mass event where we need to aggregate information. In the Midland area, my counterparts down there used it for the flooding that happened when the dams broke, so that they could give the public a quick and easy phone number to remember, that they could start reporting the level of water damage in their homes, so that they could start getting FEMA dollars rolled in, because once you hit a certain amount of estimated dollar damage, then FEMA starts to get involved. So 211 had the capacity of handling this mass influx of calls and aggregating all that information for the different people that were calling. So I know that was a longer answer. Yes, a person answers the phone. As for the second one, Gail, I don't know if you're on there. I'm a moderator of Emmett Helping Hands, and I'm in the Charlevoix one and some of the other ones. Honestly, sometimes it has to do with capacity. Sometimes I do not have the capacity to get in the middle of what is going on, or I've seen that person, this is their third go around with something, and I know that they've been in contact with agencies, and I know that there's something else they're not saying. But in the beginning of the pandemic, when these sprouted up, it was a really useful place to point people towards where to get vaccinations, where to pick up masks, where to get testing information. And I've seen some of the people that have been on there from the beginning picking up the slack on some of that and educating some of their other Facebook users that are on those groups, which has been nice, because then it's working the way that it's supposed to. You're getting information out into the public, and then the public is picking up the slack. I don't know, Gail, if you had anything to add on those.
Yeah, I think that's, I mean, I look at Facebook generally in the evening when I'm sitting in my recliner chair watching TV. And generally, there are wonderful people who have already recommended contacting Women's Resource Center, or whatever the resource might be that is needed. We do on our Facebook, there is a way for somebody to message us directly, but we're asking them to call that help and information line. And there's a lot of reasons for that. There's a safety reason for the Women's Resource Center. It's really hard for us to tell in a Facebook posting if it is the actual survivor or if it is the perpetrator trying to get information. So we're going to want that survivor to call us and talk to the help and information line, just to make sure that's who we're talking to and it's not somebody fishing for information. You can be rest assured that if it is somebody who is in intimate partner violence and they are in need of temporary shelter at the safe home, and they've contacted us, we are trying to make arrangements for them. If they are telling you some type of other story, then there's more to the story. There's something else going on. And I think I could say that for almost all of the resources that we have in this area. We are all trying to do our best to connect with people and get them the supports that they need. Sometimes it's not the supports that they want. They want something different. And we all have limitations on what we can do. I think it's beautiful when I see people in the community also offering assistance and offering, I have size 12 pants that I don't need anymore. Fantastic. That's wonderful. I like to see that. Our gold mine managers have, they can assist people with clothing that walk in the door. They don't have to be connected to the rest of our services. They don't have to be seeing an advocate, seeing a therapist. Gold mine managers have that I don't, authority is such a big word, but
Discretion.
they have the discretion to do that. Yeah, they can help people. If somebody comes in and they need a winter coat, yep, they can just give them a winter coat. So, you know, when people want to do donations of winter coats to go directly to the safe home, I really encourage people to donate those to the resale stores, because all of the stars have to align to get that perfect winter coat to that person. And yet we're sending people to get winter coats at Goldmine that they don't have to pay for. All they do is go pick them up and walk away with a winter coat. So, let's see, yeah, I think that answers the one for the Facebook page and Helping Hands. As far as confirmation, we really need to talk to people.
And there's a couple other questions about the safe house. What is the average length of stay for the safe house? And why is it more dangerous for a woman to leave an IPV situation than to stay?
Great questions. So the first one, the length of stay, we really don't have an average, a maximum, a minimum length of stay. We're a temporary emergency shelter, and we recognize that there are individuals who might only need shelter for a couple days. Maybe they have just a transportation need to get to wherever their family member is, that's where they want to go. We're gonna help make that happen. We're gonna help with that transportation. And we also recognize that there are all different levels of people in our community. And some have more resources than other people have. Some have more barriers than other people have. So if I'm a single person looking for an apartment, I might have fewer barriers than if I was a single person and maybe I have 3, 4, 5 children that I'm looking for a place to stay. Housing is limited, so we're all working with that limitation. So we really don't, we don't limit, we don't even count, we count how many nights of lodging, but we don't average it out generally to say how long is a length of stay. I think that one slide you might have seen, it was like the safe home. We do average it this way, like we had over 6 people a night on average. And really that's because we want you to think about like, what toilet paper does that take? What paper towels does that take? How many gallons of milk do you think we're going through in a week? That's why we look at that, average, how many people on average stayed at the safe home per night. But we really don't average a length of stay because we recognize everybody has their own story and their own situation. And it's not cookie cutter, it's all different. And then, so that, why is it more dangerous? And it's like, I don't know if I would want to compare it to more dangerous to stay or more dangerous to leave. But I do want to recognize and have you recognize that at the point of leaving is when it is at the highest danger. And that's because as a perpetrator, you know, my goal is to keep you under control. And most of the time, I can do that control without ever really laying a finger on you, right? I've isolated you from your family. I have gaslighted you into thinking you've got nothing going for you. You have no friends left because I made sure I pushed them away. I might have even talked you into leaving your job because I'm going to take care of you. You don't need to work. And so all of those things a person has done to keep control, maybe they threaten you. And yes, there's also physical violence that is used. So it's all of those different types of controlling behavior that a perpetrator is going to use. And when a perpetrator loses control, that's when they are at the most unpredictable. And that is when they might decide to go to that next level. And so I've controlled you lots of different ways, financially, and now you're leaving me, and now might be the time I decide to use violence. And it might be the worst kind of violence. Does that make sense? So I don't know if I want to say, like, I'm not comparing, it's a balance. All I'm saying is that's when a survivor is at their
Come here.
highest risk.
Come on, girl.
And does the safe home help with housing?
Yeah, so we have a couple different ways that we help with housing. We have advocates who are experts at housing, are experts at helping apply for housing assistance. And have real relationships with the different housing units and landlords in the area. So yes, we are assisting with housing in an advocacy way. And then we also have what we call our transitional supportive housing, where it is state funded, and we can assist with rent, utilities, sometimes bedding or dishes. And we can do that for up to 2 years for a survivor of domestic violence. And it can be sexual assault also. It's just sexual assault doesn't have as much need as domestic violence. Generally, domestic violence, you've been forced to leave your home and you are looking for another place to stay. So we have that as well.
And can you talk a little bit about United We Smile?
So that is something that we have through, it's located in our United Way offices down in Traverse City. It is a new dental clinic that we just opened. We're working in collaboration with the U of M School of Dentistry. It is one of the required rotations for their dentistry students, and part of that is because our focus is on pregnant people, children, and veterans, but also those who have developmental or cognitive disabilities. So one thing that happens in some dental practices is that dentists don't have the skills to deal with patients who have developmental or cognitive disabilities, and so they get frustrated, and those patients end up either leaving that care voluntarily or being told that they're not welcome. And so our goal with part of what we're focusing on is making sure that these dental students have that skill set so that when they open their own dental practices or join other ones, they feel empowered enough to be able to take care of everyone. So one of the parts about that is that we have some quiet operatories in our space where the lights and sounds can be controlled, where it's it's a soundproof room, it's quieter environment. And so we are able to meet the needs of whatever person is coming in there. Additionally, we have a community health worker in that space. So normally you'll see them in like the health department or other spaces like that. We have one on staff that's helping families find resources as they're in there for their dental appointments. In addition, we also have a resource room that has clothing, shoes, and shelf-stable pantry items that people are welcome to take whatever it is that they want in there. And the great thing is that whenever we bill out for Medicaid services or through any insurance that the veterans might have that are coming in, once that's done, there's no other cost. So we do not charge out of pocket to any of the patients that come through for dental services. I was down there last week doing some other work in our administrative office, and there was a family that was there from the UP because this was the closest place that they could get dental care. And the cost of driving there for not having to pay out of pocket for dental care was worth it for them. So there's definitely a need. We've had some criticism about being in competition with Dental Clinics North and other initiatives by other places, rest assured, all of those entities have said there's plenty of need to go around. So they are actually quite happy that we are there as well, assisting, and we'll certainly point to the other resources if we can't get somebody in time. But we have appointments available right now. The biggest thing for us in the Charlevoix-Emmet County area is how do we remove that barrier for people going down? So we do have some gas cards available. If someone makes an appointment in our region, they can tell the person that they're making that appointment with that they need a gas card, and it can be sent to them to offset that cost.
And we also have a question on follow-up. What kind of follow-up do you have on your clients? And do we have any idea of what kind of happy endings that you have uncovered?
Gail, give us a happy ending.
I was wondering if that was for me or for you, Rebecca, and I'm gonna change it to happy beginnings.
Yes.
Because as soon as you make that phone call to the help and information line, it is a happy beginning. And as soon as you leave that unsafe situation, it's a happy beginning. And so let's reframe that to happy beginnings. And that a lot of people say, how do you measure success? I'm like, as soon as they call the help and information line, that's success. I think that takes a lot to do. So we'll switch that to happy beginnings. And we know that sexual assault is one of the most underreported crimes there is. And domestic violence is right there next to it.
Any other questions?
Any other questions? Thank you so much, everyone, for joining us. Oh, Kate was a yes. Kate, yes with a question?
Oh, yeah, can I just ask it? I was
Sure.
gonna take it. Let me turn my video. I was just wondering, if with folks who come through the safe house, if there are resources to help them pursue like legal action against their abusers.
So there is Legal Services of Northern Michigan that can help with some. There is community mediation that can help. There are whatever a survivor wants is what we will help them pursue. I think there are a lot of survivors who are they're just really happy to be where they're at and they want to just move forward. One of the things that we do have, and I know it wasn't asked, but Lisa, we've got 2 minutes, is our education and employment services. So we have individuals who want to maybe help build their skill set, build their resume, and we have a person right at North Central Michigan College that can help them in that direction, whatever they want to do. We really try to help whatever their goals are. We're gonna try to help facilitate them to get to where they want to be. And maybe we're not the exact right person, but we're gonna connect them to who that right person is.
Sue Vandeventer?
I was going to ask just real quick. Do you see evidence, either one of you, that reaching out, women that come to the Safe House or in your Alice program, that helps break the cycle of poverty and that domestic abuse as they go forward? Are their children less likely to be involved in those situations, and economic advantage from getting out of those situations, things like that?
Well, I'll take a quick stab at this, Rebecca. So we know that with the right supports, that women can thrive. And we also know that with the right supports, children are resilient. So if we can get them the advocacy, the therapy, for those folks, they can thrive.
So what I would add to that is that anytime that we can break down the barriers of any stigma, we're increasing the chances of that resiliency, whether it's in a child or an adult. We see that in terms of addiction, where one of the biggest things that you can do to turn around addiction is making sure that a person has connection, which is part of the reason why the pandemic was so detrimental with a lot of people going through stuff and not having those connections. And so anytime that we can open up those spaces, Gail mentioned it in her slides, of having safe spaces where the conversations can happen, where people are being treated with dignity, where they can tell their stories and know that they're going to be supported. Anything that we can do to increase that connectivity is going to help support in some way or another.
Thank you. Thank you again, panelists. We so appreciate you sharing your time and your expertise. It's so good to be exposed to you both, and many of us know a little bit about what you both do, and it's just adding every time we hear you, adding to what we know is so important. Thank you. I have two. Now that does conclude our forum, but I do have two fast announcements. One is that there is a book discussion tomorrow for the league members. Give People Money is the book we voted on discussing in March. And that's at 7 o'clock. And there's a Zoom link for you on our website. And our next public forum is Wednesday, April 10th. And the topic is, believe it or not, a hot one: protecting our waters through septic system regulation in Michigan. Despite having all the fresh water that we have, Michigan is the only state without unified septic regulations. So we have two experts to speak on that topic. And that's in partnership with the Petoskey District Library, and is always free and open to the public, not just league members. So you'll hear more about that and can certainly invite neighbors. Thank you all again for attending. We hope to see you next month. And good night, everybody. Thank you, Rebecca and
Night.
Gail.
Thank you.